One of the fellows at that time told me about an attending who was doing innovative research, which was something amazing that was introduced to me. And when I was at the interview day, I saw that he wasn't one of the people interviewing me. But during the lunch break, I actually ended up sitting next to him and chatting with him about that research. And he was one of the friendliest, most down-to-earth attendings I'd ever chatted with, even though he was doing amazing research. And that actually is the big thing that I remember from that interview and what drew me most here.
When I look into this program, one of the things that really catch my eyes was the program director and the now associate program director were both women. And that really caught my attention. I really liked that I would have mentors that would be on my same position, which is we're in cardiology, we're the minority.
The diverse population, the very rich pathology that the fellows seem to see, and also the kind of friendship and closeness that the fellows had, which kind of spoke to me.
If I were to choose one word to describe it, it's family. We care deeply about our trainees. We don't see them as just the trainees that come for the 3 years. We form lifelong, lasting relationships. So caring deeply, family, community, where we grow together and we help one another. That's our community.
I was so surprised moving from residency to fellowship because I used to be afraid of attendings, and I was surprised that everybody reaches out to each other. It's very easy to pick up the phone and call any of the attendings. They all expect you and want you to call them. Even at like 2 a.m. in the morning, you call to wake up the CCU attending. That was pretty surprising how friendly they could all be and helpful and supportive in the moment.
I think it's absolutely wonderful, the beginning July of a new fellow's year. They come in on top of the mountain. They've completed the journey through internal medicine and end up in cardiology where they go, maybe I'm not on the top anymore. And that first year as a first-year fellow is probably the time in their lives where they're going to learn the absolute most that they'll ever learn.
Being a safety net hospital, we see some really diverse and really severe pathology, which I think really prepares you going out into the community, because I feel kind of like I've seen everything. So I think that kind of helps going into other hospitals, knowing that you've seen a lot of different things.
We have an opportunity and also the privilege to take care of patients with the most complex medical conditions. This definitely makes it a unique setting for any trainee to essentially see it all.
The diversity of our faculty and the faculty to fellow ratio also enhance the teaching experience, in addition to the hands-on teaching experiences within the invasive cardiovascular laboratories, such as cardiac catheterization in interventional and cardiac electrophysiology.
From the academic standpoint, from the research standpoint, from the procedure standpoint, we can do whatever we want and whatever is allowed to us to do it in the program. We learn a lot of procedures. I mean, cath lab, EP lab, CCU, and as I say, we have tons of opportunities to doing research, and that's something that I believe we have a privilege to have it in our institution.
So I actually did my training here, and the first 6 months of the first year we're just building the foundation for the fellows. So they'll go through the echo lab, the nuke lab, they'll have clinic, consults, and after those 6 months is when they start doing the more intense rotations like CCU. And in terms of autonomy, it's sort of a graded process. So, in first year they won't have as much, but by the time they get to second and third year, they're able to handle a lot more on their own with more indirect supervision.
Our CCU and our consult service are both very busy, and with the amount of workload that we have and the amount of experience we get from seeing different pathologies, and from the CCU in specific, treating patients with acute heart failure, STEMIs or end-STEMIs, and all different variety of pathologies, really helped me figure out to myself also what I want in the future and what I'm leaning towards. I really like it because when you don't get that experience, maybe you're not sure if that's something you want, but here you get everything.
A little cheesy, but I feel like I've grown the most, had the opportunity to grow the most in this program. You know, all the other programs, med school, internal medicine, all these places, I feel like I've always been fumbling around trying to figure out where I'm going. But here's the first time I felt like I've had true mentorship, I've had true kind of collegiality, like a true family here to help and support and guide me throughout this whole process. I think that's also a big reason why I am coaching as well, to have the opportunity to try and give back and make this program even better.